Good day and welcome to A to Z Online Media Platform. Today, A to Z Online Media Platform is currently at the Connaught Hospital witnessing the unfolding of the Dr. J.B. Ruben Coker Pediatric Ward. Journey to Health has become one of the controversial issues for children within the Connaught Hospital. And as a result, or to salvage the situation, the Ecobank, which is a financial institution, has decided to refurbish the ward, the children's ward for at the Connaught Hospital, which is the pediatric ward. So stay with us as we continue to tell you a lot of things that unfolds here. Can you kindly tell us your name?
My name is Aina Mo. I'm the Managing Director of Ecobank.
Okay, Managing Director. Can you please take us through what we are currently experiencing as of today?
Ecobank adopted Ward 1 at Connaught Hospital, which is a children's surgical ward. We adopted it 10 years ago and named it after a leading pediatrician, in the person of Dr. Ruben Coker. And over the years, we have been managing it and maintaining it, but then it was in disrepair, and we did a major refurbishment, providing 20 beds and everything else that you've seen in the ward, and this beautiful garden for the children.
Right. So what does this mean for children, particularly in this particular ward?
That means that children who have surgical issues, whether it's burns or operations, as they call it in the locally, will be able to come to a very nice environment that has proper equipment, proper beds, safe, clean, in a good environment where they'll be able to get their healing. As the nurse said, the matron said during the thank you, risk of infection is very high in surgical patients. With a clean environment, that is going to be safe. And it's just a nice space. We made it child friendly. We put pictures of cartoon characters. Lovely, lovely space. And we believe that it will help their healing.
Good afternoon. My name is Matron Betsy IDS Dean.
Matron, I know you are happy with regards to the newly refurbished ward. What can you say to viewers with regards to this particular development?
I am not only happy, I'm excited, I am thrilled, I am so much overwhelmed, happy. I'm really, really happy because, when you look at the ward, it's like the standard, the way they've renovated it, the way they've refurbished the ward, you can measure it to any international standard. And for children, when we say the environment, when I look around and I see the beautiful beds, the chairs and everything, it's clean, so it's a contributive factor to the healing process. This will, when the children are admitted here, just for them to be in the ward, it has contributed to their healing. So this will go a long way in helping the children heal, because in surgery, because I'm a surgical matron, in surgery, the prevention of infection is very, very important. And one way you can prevent infection is by cleaning your environment, the area in which you live, the area in which the patient is admitted. So tell me, if the patient is admitted in a very clean and beautiful environment like this, obviously it's going to contribute to the healing process of that child. So I am excited, I am happy, and I thank Ecobank for this marvelous work that they've done.
The structure of the ward is a pediatric surgical ward, meaning all surgical cases that are operated on children are admitted in this ward, including orthopedic surgery, bone surgery, general surgery on children, neurological surgeries on children are admitted in this ward. So it has about 25 beds, which we have newly donated beds by this reconstruction process. We have furnitures, we have TV screens with television facilities.
This hospital is one of 6 and the main training site of the teaching hospitals complex, which was established by an act of parliament in March 2016. The leadership of Connaught Teaching Hospital, backed by superb partners, have been changing the ambience of the hospital and improving its training environment for its residency training and service delivery programs. Since they embarked upon changing the ugly narrative of the hospital a year ago, a lot of external changes can be seen. It is an example of what can happen when you have young patriots with the right attitude, passion and commitment to the progress of their profession.
This year, 2022, marks the 10th year of Ecobank's relationship with Connaught Hospital through the adoption of the Children's Ward that we fondly call Ward 1. In 2012, Ecobank Sierra Leone, under the leadership of my predecessor, Mr. Clement Jojo, made the decision to refurbish and adopt the Children's Ward in the country's main referral hospital, Connaught. Ecobank believes that as a corporate institution, it is our responsibility not just to contribute to any project for the sake of it, but rather support projects that will touch the lives of many people and create significant impact in the communities in which we live and work. Thus, in 2022, we adopted the Children's Ward and refurbished it at a cost of $30,000. For us at Ecobank, that was money well spent, as investments in health and education of our children symbolizes an investment in the future of Sierra Leone.
Dr. Robin Coker, Olubuke Robin Coker, as he is better known, was passionate about two things, beyond his children, of course, and that was medicine, especially with respect to children, and Freemasonry. And Freemasonry he listed it as his hobby, but there was a good convergence in as far as a lot of Masonry is about charity, and a lot of the charity that Masons espouse has to do with healthcare. And in fact, there are many a person in this country who has received the benefit of medical assistance through Masonry, which is why I want to take the opportunity to recognize friends of the ward who have stood with the family and Dr. Robin Coker.
Step in the shoes of Ecobank and be able to show that we have a hospital that we could all be proud of. If you're sick today, we don't want you to fly to Egypt or to Nigeria or to Ghana or to somewhere else to get care. When you have a facility here, when the doctors here are as trained as any of the doctors around the region. So the fact that we have these doctors here, what we need to do now is to grow their numbers. What we need to do now is to provide the essential ingredients for them to deliver on services. We have a telltale sign that's showing that we're going in the right direction. The president is looking at healthcare not as an end in itself, but as a platform for development. What he's saying is, if you have a very educated populace, you have a healthy populace, you have a populace that's food secure, you have a populace that has the requisite infrastructure and support. Those four ingredients are enough to make you the best person that you could be. So we're looking at other ways of ensuring that we have high-level regional hospitals that will be able to service our hospital, and we upgrade all of the district hospitals. So right now, the government is expending about 76 billion leones to help us upgrade all of these district level hospitals. At the same time, I'm also looking out for funding to create major provincial hospitals that hopefully will be linked with the teaching hospital complex. We went to Touba in Senegal and saw a provincial regional hospital of 300 beds with 18 different disciplines, from cardiology to cancer care. If Senegal could have that at the district level, why can't Sierra Leone?
You know, I was called upon to give this vote of thanks just a few moments ago. And when I plunked down my phone, I said to myself, what do I say to Ecobank? What do I say to an organization who has given so much to us? What do I say to an organization who has done such an immense job? What do I say to the organization who has changed the face of the Ward 1, who has put a smile on the children's faces? So I said, all I have to do is to say a big thank you. Thank you so much to the management and staff of Ecobank. I thank you so much. You know, in health, they say that the environment in which the individual is born, the environment in which we live, in which we play, and in which we work contributes to our health. And so it is when you talk about surgery. The environment plays a key role in prevention or contributing to infection. And what have you done? You've changed the environment of the pediatric ward. So therefore, you have reduced infection drastically. Thank you so much. To our Honorable Minister, your dynamism in changing the face of health in Sierra Leone.
Back to front. Okay, ready? 3,